you did a great job summarizing the role. Before I jump into a slide deck, I want you to know, please consider me your partner, your collaborator. I want to get to know all of you. I want to understand your successes and your challenges. My role really is, just like Zoe said, to serve as a connector between the great work that you all are doing and the justice system. So a little bit about me. I have a JD and an MSW, and I'm also a licensed social worker. I started my career as a public defender in Marion County, serving in the problem-solving court setting, specifically behavioral health court. I also represented people facing involuntary civil commitments. Then I moved on to the Hall Center for Law and Health at McKinney School of Law. Some of you may be familiar. I was the associate director there. And then I moved to a role with the Judges and Lawyers Assistance Program. And that's a well-being organization for our legal profession. And I like to say that was the final piece of this behavioral health puzzle that I needed to then launch into this next role. Because when I was a defense attorney, I knew that I was feeling, burned out and saddened and by what I was seeing in the system. But I didn't know that so many others were feeling that too. So I'm here to tell you that, what you're experiencing, that your justice system professionals are experiencing, we all have the same goals, and that is to serve people to the best of our ability. So I'm really excited to be here, to thank you all, first of all, for all the great things you're doing and to continue developing relationships. Just like Zoe said, we've run into each other quite a few times, but I also see so many of you that I've already met at various events. So please keep reaching out, keep connecting with me, because that's how this is all really going to work. So with that, why don't I start sharing my screen? Okay. Can someone give me a cue if we are good to go? Okay, thank you, Zoe. All right. So the title of this presentation is Communication, Collaboration, and Relationships. So if you could just keep those keywords in mind, I promise we will circle back to them. All right, so to start, I'm going to start us at a place that you all know very well, and that is, what is behavioral health? I know I don't have to define this for all of you, but I did want to keep this slide in because this is the exact definition that I provided when Zoe and I spoke together at the annual judicial conference. And I think it's important for you all to know that definition that's been provided to judges and justice system stakeholders. So first, mental health and substance use disorders are obviously part of this behavioral health definition, but these other two pieces, life stressors and crises, and stress-related physical symptoms, I think are key to remember as part of this behavioral health definition. This definition comes from the American Medical Association, which I love pulling this definition from the medical field. The best analogy that I've read is a physician who said, I treat, let's say a person comes in my clinic with asthma. I do everything I can to treat that person's asthma, but I am doing that person a disservice if I don't also address the mold that is occurring in their home that's making them sick in the first place. And that's the exact same thing that I'm encouraging our justice system professionals to do, is really think hard about a person's justice system involvement and what could be at the root of that justice system involvement. And that's why these partnerships with you all is so critical, because that's what you're so good at, is that holistic care that really wraps someone around in services. So similarly, what is behavioral health care? This is where you all come in: prevention, diagnosis, and treatment. Again, that's from the American Medical Association. And again, why these partnerships with you all is so important, because that's exactly what you do every day. I know that these are not new statistics for any of you, but we know that 1 in 5 US adults live with a mental illness, and over 13 million adults live with a serious mental illness. You know this because you see it every single day. In 2020 alone, 40.3 million people had a substance use disorder, and 17 million people had a substance use disorder and a mental illness, that co-occurring condition. But what's Even more challenging is the significant treatment gaps exist. Again, something you all know because you're in the trenches dealing with this every day, that in 2020 in the US, less than 10% of people who needed substance use disorder treatment received it, and less than half of adults with a mental illness were able to receive needed mental health treatment. So it comes as no surprise to any of us that those things taken together often lead to justice system involvement. A statistic that's not on the slide that I want to point out is actually research shows that only about 1 in 10 people encounter the justice system because of their mental illness alone. It's all of those things in that behavioral health definition, right? The life stressors and crises, the stress-related physical symptoms, coupled with the substance use disorder or mental illness that cause this justice system involvement. And I think that's important for all of us to note. But then those behavioral health issues often lead to justice system involvement. People with mental illnesses in the US are 10 times more likely to be incarcerated than they are to be hospitalized. And more than 70% of people in American jails and prisons have at least one diagnosed mental illness, substance use disorder, or both. So then these vicious cycles unfortunately emerge for people. Oftentimes their behavioral health condition was the reason for their justice system involvement. But then once involved with the justice system, those behavioral health conditions are only exacerbated and a person is now in this vicious cycle of justice system involvement. And the justice system, unfortunately, is now facing a behavioral health crisis. Judges, probation officers, community correction officers, prosecutors, defense attorneys are being forced to face the world that you all live in every single day of behavioral health care because 70% of people in our jails and prisons are experiencing this. The justice system is the de facto entry point for obtaining treatment and services. The criminal justice system has become the primary referral source to substance use disorder and mental health care. And correctional institutions have had to become de facto mental health providers. So what have we done about this? Those are the challenges that we all know so well. But I want you to know, if you hear nothing else today, it's that our Supreme Court is taking significant steps to do something about these challenges. And that started with the National Judicial Task Force to examine state courts' response to mental illness. Our very own Chief Justice Rush and Justice Goff, who I believe has spoken to this group before, are on that task force. And this group set out to assist state courts in their efforts to more effectively respond to the needs of court-involved individuals with severe mental illness. So to really get at, are courts equipped properly to recognize and respond to mental health in the court system? The report, which is linked here for you, and Zoe can help me get that out if we need to afterwards. The report is ripe with recommendations. It has a ton of resources embedded. The National Center for State Courts has gone on to create a behavioral health hub with trainings and resources for justice system stakeholders. I've put some of the recommendations here, things like deflection and diversion to treatment, reforming the competency system, court and community collaboration, person-centered justice, training and education, behavioral health equity, incorporating voices of those with lived experience, and children, youth, and families. Those are just a few of the recommendations in the report. So I encourage you all to take a look at it. But specifically, one thing that has already flowed out of this recent report and effort is the creation of my office and my position, the Office of Behavioral Health. So Zoe did such a great job introducing the role. I'm going to talk about it a little more just to make sure you understand how I can serve all of you. The Office of Behavioral Health is embedded in the Office of Judicial Administration of the Supreme Court. The Office of Judicial Administration is the administrative arm of Indiana's Supreme Court. And now the Office of Behavioral Health exists in that administrative structure. Specifically, the office is designed to connect justice system stakeholders to resources in their communities. I hope you know those resources is all of you. So that's why it's so cool to be here today, because this is how we start that connection, is building these relationships. The office provides education on matters of behavioral health, and that can be education to judges, community correction officers, probation officers, prosecutors, defense attorneys, but it can also be for all of you if you need anything, education as it relates to the justice system. The office also supports the Behavioral Health Committee. This committee is made up of 15 judges statewide who have raised their hand when asked who is passionate about this issue. And we have a group of really passionate, interested judges who want to do something about behavioral health in Indiana. All right, so many of you know that Zoe and I, when we first met, one of our very first priorities was to create free-flowing communication, dual communication that flows from the justice system to all of you and from all of you to the justice system. So one of the first things we did was, let's ask people, what do they need? What are the successes? What are the challenges? So thank you to those of you that participated in that survey. If you didn't get a chance, don't worry, there are going to be many more opportunities. But 17 of you responded from 14 different facilities. And we asked you, please share your most common challenges when working with the justice system on behalf of a client. And please share any successes you have had when working with the justice system that led to a better outcome for a client. Similarly, we asked judges. Zoe and I spoke on a panel together at the annual judicial conference, and we actually broke out into the whole second half of our presentation was devoted to hearing from judges. We broke out into small groups and asked these exact same questions. Please share your most common challenges when trying to connect with a treatment provider in your community. Please share any successes you have had in developing relationships with treatment providers in your community. So we are going to talk now about some of those results. All right, let's get into the challenges reported by treatment providers. I was able to group the challenges. So many, just because it's listed once, it does not mean that only one person said it. It actually means probably multiple people said these things. So first was deference to treatment plan. People said, let the clinicians evaluate and determine what is clinically appropriate. Next was communication. Someone said really elegantly, when the communication loop is broken down, it can impact client care and outcomes. Next was navigating expectations of the justice system, and a really astute observation that timelines of the treatment world and the justice system can often differ, and the position that puts people in. And then, of course, stigma. We have to continue combating stigma around harm reduction and medications for the treatment of substance use disorder. But let's now talk about some of the successes reported by treatment providers. So just so you know, there were many, many answers that I could have put in these buckets. I was actually struggling with how to make this slide succinct because you had so much to say. But I was excited to see that they were easily grouped into 3 themes: communication, collaboration, and relationships. So to summarize each one, I pulled quotes. So communication, let's start there. Someone says, we have been especially successful in terms of having open and honest communication across many sectors. There is a high degree of trust and willingness to provide and receive feedback. Wow, that's some really open communication that's been established there. That's amazing to see. Next is collaboration. Someone said there are some great criminal justice partners who collaborate well with treatment providers. They stay in constant contact with the treatment providers and take clinical recommendations that are made and hold the individual to those. They collaborate with the treatment provider if a client is struggling, maybe had a relapse, but is working with the treatment provider to get back on track. That's some great collaboration. That requires, again, communication, but then take it a step further and let's collaborate to make sure that we can help this person succeed. And then third was relationships. Someone said, we have been working hard to develop relationships with the court systems to meet the needs of our clients. Sitting on the drug court meetings and setting up meetings to have on-site visits has helped to develop better relationships with the court system. So those are some really significant successes. So I'm thankful to you for sharing those and for giving all of us some examples of when it works, it can really work well. Let's get into challenges reported by judicial officers. I don't think these will surprise any of you, but challenges reported were wait time, time between a court referral and a participant's first actual session, access, availability of beds, funding, options for litigants who can't pay, and then just some justice system stakeholders need more connection. Someone said, I don't know my treatment provider or what services they offer. Let's look at the successes reported by judicial officers. Does anyone notice anything? Feel free to unmute yourself and shout it out or put it in the chat. But I'm curious if anything jumps out at you. The 3 words across the top, I hope. I didn't wait long enough for anyone to answer me, but I know it's early. I hope you're having your cup of joe as we're speaking, but communication, collaboration, and relationships. And I was not looking for the same 3 successes to emerge. That happened very organically and naturally. Again, I had many success stories I could have pulled. I pulled 3 that really highlight these 3 themes. So let's read these. Communication. Someone said a cross-disciplinary group in our community meets weekly at a coffee shop to exchange information on resources and events. How cool. People coming together just like this, cross-discipline to meet and talk about ideas and challenges and successes. Collaboration. Someone said our local treatment provider has created several new evidence-based programs to assist litigants. Often therapists come to treatment court graduation presentations. It's an amazing moment for the participant, the therapist, and a learning moment for everyone. And oftentimes what is a shoulder-to-shoulder filled large courtroom when the therapist then gives words of encouragement and affirms their successes. Wow, I would love to be in that courtroom. That must be such an amazing moment. And then relationships. Someone said having treatment providers as part of our JRAC and also just simply building relationships with individuals who work for the treatment provider team has been helpful. So again, some great successes, some great work happening in our communities. We talked about challenges, we talked about successes. I like to stop here for a second and say, it's okay if this feels challenging. The justice system has systemic challenges built into it. It's okay if this feels challenging. It's because it is. But what stood out? I hope it was the themes that emerged: communication, collaboration, and relationships. And one of you in your survey responses gave me the most beautiful quote to highlight this, and that was, we all want the same thing: healthy people and safe communities. And that's exactly it. Everyone is serving the same population and wants to see that population succeed, wants to see people thrive in their communities, and wants our communities to be safe. So I am here to help facilitate relationships. Zoe is here to continue this communication. But what we really, I hope we all can keep in mind is that we all want the same thing. And it comes down to, I think, communication, collaboration, and relationships in so many situations. So let me leave you with a few more thoughts. If you could please build relationships in your community. I encourage justice system professionals to reach out to all of you. You saw in the Office of Behavioral Health's mission statement, one of my efforts is to help justice system stakeholders connect to resources. That's you all. So help me do that. You can reach out to your local justice system team and establish a point of contact. I think it's really important to point out that there's some work to be done to understand each other's lingo. Judges aren't trained in mental health lingo, and I know that the court lingo can sometimes get overwhelming. So taking that step just to learn each other's lingo is really important. And then discuss challenges and opportunities so that we can innovate. And the really cool thing is so many of you are already doing this. That's why we have so many success stories out there from the treatment side and the judicial side. So if you're doing it, please keep doing it. Please take the next step and keep up the great work. We're here to help you. The Office of Behavioral Health, the Behavioral Health Committee, your local JRAC, and then of course Zoe. We are committed to continuing this two-way communication that we've gotten started. And we want to hear your ideas and your solutions. We want to hear your challenges and successes. So I hope that you'll reach out to meet with me and get to know each other, because I truly want to hear your ideas and your solutions. Remember, it feels challenging because it is challenging, but together we can start unraveling this challenge. It's going to take all of us to continue that communication, collaboration, and relationships. So thank you so much for listening to my spiel. I think we have a few minutes. I'm happy to take some questions. The QR code will take you to the Office of Behavioral Health website, but my contact information is also on this slide. So thank you for your time this morning.
Okay, now that we've had some cup of joe flowing and a wonderful presentation by Brittany, what questions do you guys have for Brittany?
Zoe, this is Diana.
Hi.
Hi, Brittany.
Hi.
I responded to your survey, and I was wondering, there are some great communications and great stories out there. There also are some problem areas, and I was wondering if your department has plans to reach out where you are aware that there are potential issues and problems.
Of course. Yeah, great question. Absolutely. Absolutely. That's, I think, where my support can really come in, is if there's a challenge going on, is bringing the correct people to the table, facilitating communication, and really moving towards solutions. So if there's challenges happening, I would love to know about them so that I can support you.
Yes, and you can reach out to her via the contact information that's on the slide. If you did not get that and you need an introduction, I know I've already made some of those connections. Just reach out to me and I can, do that, so that, because I know there are some individual situations, and Brittany and I have talked about some of those, just from a systematic standpoint, right? But the specifics and what goes into those, for example, one that we've talked about systematically is, some judges and court service areas don't necessarily support MAT. And MAT is like that recommendation. How do we, from an education standpoint, and that's why I'm really thrilled for Brittany to be in her seat, because she can really help us through the judges speak to help in providing that education and help in providing those resources. What other questions does the group have?
Hello, this is Art Fuller from Hamilton Center.
Hi, Art.
Hi. So you had mentioned the National Judicial Task Force. And so are you saying that there are going to be more ways that this National Task Force might influence some of the items going on in the state of Indiana? Like, are there recommendations pending, that sort of thing?
Great question. Yeah, thank you. So the National Judicial Task Force report has been released and completed, but the work of that task force continues. There's actually a behavioral health committee out of the National Center for State Courts. And there are a group of state court behavioral health administrators, myself included, all across the nation that are meeting and communicating regularly. So on a national level, and our Chief Justice Rush and Justice Goff are very involved at the national level. So it continues at the national level. And then in Indiana specifically, our behavioral health committee, those 15 judges that I mentioned, they are working on an Indiana specific plan that will mirror the national task force recommendations, but make sure that they are applicable and relevant in our state. So there's more coming. The work is not done. So I hope that you'll keep up with the national work as well as our local work through our behavioral health committee.
Any other questions or discussion items for Brittany?
Hi, yes, this is Brittany with CareSource, and I'm just curious, Brittany, if there's been any education on Medicaid or managed care, and how that can influence someone's behavioral health treatment. I'm just thinking about like the new emergency detention order, and we cover services that are medically necessary. So just wondering if there's been any education or if there's room for that.
I would love to do some education on that. Our Office of Court Services does a lot of education, so I'm not, it's very possible we've done some education on Medicaid. Even if we have, it needs to be repeated, and if we haven't, I would definitely love to provide that, because you're right, it can get really challenging navigating those systems. And something that I love to say is I want to empower justice system professionals to be brokers of resources in their communities. And it's hard to do that when you don't understand, it's hard for all of us to navigate, let alone someone experiencing serious mental illness. So I actually wanted to say my office provides education, but sometimes that is finding the right speaker. So Brittany or any of you on this call, if you're ever interested in providing education to the courts, please make sure you let me know that. And I'd love to talk with you further about that.
Great, thank you. I'll get connected with you after this.
Okay, sounds great.
All right, great. Well, we are just at 9. So I wanted to just share just a couple things really quickly. If you have not registered yet this week, register. We have close to 150 people coming to Bloomington, and we have a dynamite agenda, starting with our committees on Wednesday, CCBHC from Kansas, Minnesota, and Missouri, as well as a DCO session and sessions from our own centers regarding some workforce strategies, as well as Doug and Jay's last visit with us, and Lindsay, as well as other state folks will be there. So it is a day Thursday that you do not want to miss. Friday is also an important day because we have our annual meeting where we will be voting for board members. If you have not sent your proxy, if you will not be there, CEOs that are on, please make sure to get that to Denise. We also have some pretty big decisions to talk about. So just it broadly, KeyPro, Accentra, and our next steps on what is taking place there at the state level and how we want to proceed, as well as many CEOs and CFOs were made aware of mental health funds recovery situation yesterday. We are going to be discussing that with David Josie and what our next steps might be as well. So Friday is also a very important day to have at least a representative from your CMHC there, if not a couple. And then I also wanted to share our Next Gen conference with Jessica, who's on. I see your beautiful face there, and Shannon. They will be doing Real Talk from the Front Lines of Primary Care and Integration, a webinar. Leanne has sent out that information, and that will be on Monday. And then I also see folks from our Indiana Council Racial Equity and Leadership Committee, and CareSource is on. CareSource has been very gracious with sponsoring the speaker for us, Celine Webster Bass, and she will be talking about improving workforce and retention on October 17th. And that will also be a webinar. And thanks to CareSource, it will be a free webinar for everyone to attend. So I wanted to highlight those things quickly. Everything else we will be talking about starting tomorrow in person. So without further ado, I wanted to thank Brittany for her leadership and really looking forward to working with you and continuing to work with you and with our membership. And then also, Katie is our Starbucks winner. Katie Jinsky, for those of you who don't know, is now the interim CEO at Swanson Center. So she needs that Starbucks gift card, as you know. And so we're looking forward to celebrating that, Katie, with you, and we'll get that Starbucks gift card to you. Let's raise our cups. Really looking forward to having a great week with all of you. Have on your running shoes, though, because we packed it in. So looking forward to it. Thank you so much, Brittany. Have a great morning, everyone.
Thank you so much. Please reach out. Bye.